Our first student representing the Department of Community Health Sciences is Chloé Winders-Singer. Her talk is titled, "The Electoral College is Making Us Sick. What Public Health Can Do About It." Chloé.
Good afternoon. Thank you to Molina Healthcare and to the Lester Breslow Fellowship for giving me the chance to speak today. I have a proposal that is in urgent need of public health professionals, and I am here to put you all to work. We all know that the vote of every person in a democracy should be counted equally. But our American democratic system strategically and legally discriminates against urban voters through the Electoral College. This voter discrimination poses a public health disaster to millions of Americans. This is my rallying cry, and I hope that in the next 5 minutes, it will be yours as well. Let's start with a quick review. At its 1804 inception, the Electoral College protected the status of elite white males in sparsely populated slave-holding states by providing each state, even the smallest ones, at least 3 electoral votes. Today, the Electoral College continues to mathematically favor white voters in less populated states, violating democracy's primary principle of one person, one vote, and undervaluing the votes from highly populated states. These big states contain large cities, which are home to most of the country's immigrants, college degree holders, young people, and racial diversity. If urban voters were counted equally, we would have a different president today. This unjust divide between the popular will of our nation and its electoral outcomes threatens the health of America. The Affordable Care Act, despite its flaws, has allowed 20 million Americans to access health insurance. The majority of American voters chose a candidate who supported the ACA. Yet, thanks to the Electoral College, we now have a president who promises to repeal and replace the act, despite the fact that his replacement plan will cause 23 million Americans to lose their health insurance. And just how important is health insurance? The New England Journal of Medicine reports that for every 455 people enrolled in Medicaid, 1 life is saved. If the ACA is repealed, 44,000 more people will die each year. Simply put, the ACA is critical to our survival. Consider this. By framing the Electoral College as a public health risk, public health professionals can bridge the divide between the kind of healthcare that most of the country wants, the kind that marginalized urban voters depend on, and the kind that the country gets. Our field excels at uncovering critical determinants of health, and we should be evaluating the Electoral College in this very way. We should be generating data on its health impact, just as we would for any other risk. We should be submitting this data to journals, presenting it at conferences, and using it as fodder when we write our elected representatives and our op-eds. We cannot rely on the lobbyists and the reporters. We're trained to do this. We're good at it. This work is up to us. The implications of losing the ACA affect us as professionals and as citizens. Do you have a pre-existing condition? Do you want your California vote to matter? Do you work to improve the health of vulnerable communities? If you've answered yes to any of these, then you have a stake in this fight. Then you should be standing up against the health impacts of the Electoral College. Will it be difficult? Sure. But should that stop us? No way. To my respected colleagues, this is a summons. Now, more than ever, the public health community is called to duty. Let us take a brave professional stand by showing how political variables, such as the Electoral College, correlate with bad health outcomes for America. In order to advance health for all, we must come together and use our skills to promote a more just democracy, a democracy that truly counts all of us as equals. Thank you.